Let's all stand for the prayer, please. പിതാവിനും പുത്രനും പരിശുദ്ധനും സ്തുതി ആദിമുതൽ തന്നെ ആമേൻ. Lord, we thank you for yet another Thursday in our life. April 20th, 2023. We thank you for bringing us together again in this fashion to have some new vision in our life. We especially pray for our Dr. George Handisar and also what he is going to say, that we may be able to understand it and we will go into it and also implement it. That's what we want to do it. Because last 8 years you have been good to us. You have been a good God in each and every department and what all we try to do. And today also, Lord, speak to us, encourage us, equip us for something greater than yesterday. We give you all glory, honor and praise. In Jesus' mighty name we pray. Amen. Please be seated.
Psalms 107 verse 1 says, "Give thanks to the Lord, for he is good, and his love endures forever." In this world that we live in today, sometimes it can be hard to focus on the good things. You listen to the news, you hear stories, there's so many bad things happening. But if we stop for a minute to look back at our life, through all of the changing circumstances, through all of life's evolving trials and tribulations, if there's one thing that's remained steadfast, one thing that's remained unchanging, it is the Lord's love and his goodness. And it is what brought us to where we are today, and it has sustained us through all of these. All my days, he has been faithful. All my days, the Lord has been so very good, and I will sing of the goodness of God. I love you, Lord, for your mercy never fails me. In all my days I've been held in your hands. From the moment that I wake up until I lay my head, oh, I will sing of the goodness of God. All my life you have been faithful. All my life you have been so good. With every breath that I am able, oh, I will sing of the goodness of God. I love your voice. You have led me through the fire. In my darkest times, you are close like no other. I've known you as a father. I've known you as a friend. I have lived in the goodness of God. All my life you have been faithful. All my life you have been so good. With every breath that I am able, oh, I will sing of the goodness of God. Your goodness is running after, it's running after me. Your goodness is running after, it's running after me. With my life laid down, I surrender now. I give you everything. Your goodness is running after, it's running after me. All my life you have been faithful. All my life you have been so every breath that I am able, oh, I will sing of the goodness of God. All my life you have been faithful. All my life you have been so, so good. With every breath that I am able, oh, I will sing of the goodness of God. Oh, I will sing of the goodness of God. Oh, I will sing of the goodness of God.
Thank you, Deborah and company, for that beautiful music this morning. This is from my heart. In each era, each epoch, a special person arises to lead God's people into victory. We have been blessed with such a person whose dreams led BCMCH, nourished BCMCH into the most trusted place for sick people in Kerala, and also one of the best medical schools in India, who dreams, as another Jacob, of building a ladder from this house of God, from this Bethel, into the future, where all fools like me are also allowed to walk where angels tread. This morning, it's my privilege to present to you pioneer gastroenterologist, the most sought after healthcare CEO in India, and above all, human being extraordinaire, to talk to us about his dreams of building a ladder into the future from this Bethel, BCMCH 2.0 or BCMCH infinity, infinity point. Dear friends, Dr. Chandy Matteethra, welcome with a big hand of applause. Thank you so much.
I want to thank our children and our fantastic music team who came and put together a most beautiful song, meaningful song for us. Shall we give them a big hand once again? Thank you. Thank you so much. Thank you, Dr. John, for that amazing introduction. I don't know how to speak after that. I want to introduce to you somebody who is extremely close to my heart, someone who is extremely special. What is that word you use? Some extraordinaire or something, some French expression. But certainly one of the, so we had one of the leading pediatric cardiothoracic surgeons in the world introducing me. And I have the privilege of introducing to you one of the world's leading healthcare IT architects who has been gifted to us. And I did some journey with him. Nainan Chako and I had the privilege of getting to know him, move him from a small place in a department of neurosurgery in CMC, into today he has developed India's best workstation, the best. It's called the Computerized Hospital Information Processing System, and it is much sought after. I don't know whether you all know that in healthcare, people struggle because they don't understand the science of healthcare, and they think IT is simple, but they realize that. And in fact, I want to start this talk by telling you how Mr. Ebenezer Sundaraj taught me a lot of lessons. I took over as director of CMC in 2002 and thought that I knew a lot. Quickly I learned I knew very little, because one of the things we first went into was to computerize all of CMC. And to my stupid mind, I thought that the best way is to get some of the top companies in India. Ebi and his group stood by, allowed me to make the mistakes. And finally we decided on Tata Consulting Services, because everybody told me that they are the best in India. Some people did warn me, be careful. For 2 years we struggled with it. And at the end of it, we had to say goodbye to them and go back to this wonderful man and say, can you please help us? That was, I think, 2004 EB. And from there, the 19 years, out of which 10 years was Nainan Chakku and EB together, building up the team, building up the infrastructure, building up the architecture, which is today easily the best in India, maybe amongst the best in the world. So I want to introduce to you Mr. Ebenezer Sundaraj, who is helping us develop one of the best. Thank you, Ebi, for being here. Thank you all for coming to be a part of this presentation. It was, I think, in 2009 that, in life there are things that you don't plan, which just happens. And I want you to remember that. But what you need to do is to be prepared for God's intervention in your life. I was invited to give a talk in Kontur, Changanasheri. And it was a healthcare conference. And I was speaking about a model that I had in my mind. I had finished with CMC. I had this big dream that I should help mission hospitals in the country. And I had an acronym for that and a whole lot of ideas. I had lost my father because of the maltreatment in one of the leading corporate hospitals in India. And I was angry with the corporate system. And I had this mission model in mind. And that was when I was making a presentation in Kontur about a model that I had dreamt about. So at the end of the talk, there were a lot of these management leadership experts in healthcare. A young man came up to me and said, we have 2 hospitals, one in Mala and one in Koni. Would you be able to help us? That was Dr. Daniel Johnson. He was not Achin at that time. So I told Dr. Daniel Johnson that I have been to many mission hospitals, worked in some of them, and I know the malady there. And I don't want to make another mistake by joining you all to try and revive hospitals that shouldn't necessarily, it should be run well, but if it's not running well, it's unlikely that it's going to. Jiju has proved me wrong. But at that point in time, I told him, but if you are thinking of something big, if you're thinking of a hospital of the highest standards, because being in mission does not give you the freedom to mismanage, to misrule, to do all the wrong things, and then blame it on mission, blame it on goodness, blame it on spirituality. You can't do that. But if you're willing to come with me on a big journey like this, I'm ready to be there. And that's how this dream started, and that is how I am here today. So, over the last 8 years, God has been very good to us. And we are in the process of looking at the next 8 years. So this presentation is to try and present to you some of the thoughts that we have, and also to ask you to please write to me with your thoughts and ideas. Because as we were preparing this, I realized that I don't know a lot of dreams that you all have. And it's important through the retreats that we're going to have and through the presentations, discussions that we're going to have, that we get to understand each other better so that we will create the best medical college hospital in the country. I want to thank Dr. Grace Mary John for helping me with these slides. I'm no good with all this, but even as I present, I'm grateful to her and a whole lot of other people who helped me to pretend to be something that I'm not. So this is where we were, or rather before that, there was another picture. So maybe this is where we stay. So it's people come and are fascinated by the architecture, and I'm so glad that I could also be. Can you put off these two lights, please? The fascinating thing was that right from the beginning, including the architecture, the architects presented to us a European model, an American model, and this is a Victorian model. And we had the privilege of choosing it. And then the opportunity to bring together a motley crew together to be the who that started the work. You would talk about it a little more. And then this became the iconic picture that everybody presented everywhere, saying here is a hospital of class that has come. But then because the MCI required a lot of things, we had to create this, which Rajesh now puts up all over the hospital, maybe in different parts of the state as well. So we started with a vision saying we need to bring hope and healing with the love of Christ. Both these words were chosen by a group of people, of us who had a retreat in CMC Vellore. Hope is something that any one of us can give to people. Healing, we're not talking about curing alone, we're talking about healing, presenting hope and healing. And this we can do across the country. We can do it despite the fact that wherever, whatever caste, creed, color we belong to, religion we belong to, we can provide hope and healing. And that was the hope that we had. So we had some beautiful experiences like this. We had, this became an iconic picture as well, isn't it? And then recently we had this picture where one of our staff carried that baby, and that has gone viral. Ansar's wheelchair. This has made big news. Lots of wheelchairs being given by the Physical Medicine Rehabilitation Department. And Chepsi and his team engineered this miracle that happened right in our midst. This child with a rare type of genetic disorder that affects the bone marrow. The first time in Kerala that the first allogenic bone marrow harvest, that itself was a miracle in itself. I had to choose a few. I'm sure sitting there you'll be thinking of all the miracles that have happened during the last 8-9 years. Please write to me about those miracles. We're going to publish a book with the miracles, because I believe that God lives in our midst, doing miracles all the time. Justin's story, 260 kilos, coming all the way from Bangalore here for bariatric surgery, and then, okay. And this child who ingested the battery. Last week was it that we had that fantastic presentation by Dr. John Walliath, Ronnie Thomas and team, and told us about the esophageal tears because of bones and because of fish bones and all that, and how for the first time maybe in the country that we found a way to treat them. And this Nimisha was sent to us by the government because they were not confident to send this patient to any government medical college hospital. I'm telling you the truth. They said, we are sending this patient to you because we know that the best chance for her, 29 years old, 28 weaker, needed a cesarean section. Why? Because she was down with ARDS, N1H1 induced. Both mother and child were sure to die. And to be honest with you, we initially said, see, we don't have any mortality, maternal mortality. We don't want you to publish saying that this place has got maternal mortality. We had no other choice. We took the patient, and all the teams and the critical care team did a great job. And this is her yesterday when she is walking. And very soon she will be going to the ward and then going home. They are extremely poor people. I want to thank the cardiothoracic department for coming in. The believers in International Heart Center gave the ECMO that Dr. John Valiath donated to us, used it there, and that saved her life. And she'll be, and the baby at the same time. The neonatologist did a great job, and that was 1.1 kilos at the time of birth. And very soon, both mother and baby will be going home. So our patients are our witnesses. Our patients are the ones who take our story to the world, to the people whom we can help. So when you look at our mission, it is a threefold mission: to be a center of scholarship and caring of the highest order, of partnerships with other institutions, we don't want to stand alone, and advocacy to try and bring into our people a sense of values, which unfortunately is not there even as we grow, even as we become big. Now from this point onwards, you'll probably have to listen to me a little carefully, because our mission is to be the best in terms of caring, but also in terms of scholarship. So you have to be a mix of both. And you probably know all around the world what has happened is, wherever caring has taken over, they've forgotten that excellence is also equally important. Because unless you do the best, the very best, it's not fair to the person whom we are looking after. So I think we've got, as Dr. John said, we've got a very good medical college, and we can do much more. We thank the principal and her team and all our faculty for the way in which our students are doing well, and we heard them sing just now, but they're studying well as well. We have now a good Believers College of Nursing. We have an Academy of Allied Health Sciences, and I thank Riju, Joji and all that who have worked hard on that, but we are hoping that we can get it better. We have a lot of accreditations which tell the country, tell the world what we are, where we are, NABH and the NABL, all that the country and others have recognized us with. Probably one of the best was the Atal Achievement Award for the most trusted hospital, which puts a lot of onus on us, and a whole lot of awards. There was the European Award which we got in 2021 in December, out of the blue. Rosa Paracelsus International Award, again for patient care, and the World Stroke Organization, Angels, Anil and his team, Dr. John and their team, for we were at that point in time, I heard it straight from the some of the best people in the state, that our stroke management is the best in the state, and I hope we'll continue to do that. COVID Warriors Award, Dr. S.K. Matthew and his team, a whole lot of awards that we got. And besides that, the Nursing Excellent Accreditation, the NABL accreditation, NABH, and recognition by the Research Organization India, CIRO. Hridyam, we've done a great job. Most of you don't know about this, because every other day, or at least 2 or 3 times a week, we have babies, 1 day, 2-day old, being rushed through a green corridor from different parts of the state for Dr. John, Dr. Suresh and others to take care, along with Sajid and Benson. Great team that they have, the number of lives that they are saving. Nobody talks about these things, but I thought it's important for you all to know about the fantastic work that we are doing. And we had the visits of the governor and of Shailaja teacher, I know. I just want to recognize the work done by all our departments. I've put down all our departments to say thank you to each one of you for the excellent work done so far. And we now have an advanced center of pediatrics and a center for women with 30 departments and 160 doctors working in tandem to look after women. So shall we give ourselves a big hand, please? So I want to go to the second one, which is the partnerships, where we have here Jiju, who got us this academic collaboration masters in emergency medicine with the George Washington University, and the people whom we are training and bringing up are really absolutely fantastic. And very soon we'll have the MD program as well. So we'll definitely have the best emergency physicians coming out from here. And the Karlstad University, Minnie and Jacob went and signed all the necessary documents so that we become partners with one of the top universities in Europe. Wayne State University, we are meeting this evening. One of their leaders came and offered a partnership in emergency medicine, and Dr. Arun will be taking us further. The partnership with the Nazareth College of Pharmacy. We've had a lot of webinars and clinics, 100 of them already, reaching out to people who want to learn, who want to hear. Our mission in advocacy took us all over the north, and there are 11 centers now where our students are with our faculty, reaching out to them, learning from them, but also giving of ourselves. And we just had Rajesh telling us yesterday that he's setting up 2 PD centers in these remote places, and then moving on to sending his people from here for dialysis training as well. So these secondary hospital postings have been a big success story. We had Sumita Arun going and helping in Bisamkatak. Our Medifest was a huge success, reaching out, and then the ID Congress in terms of telling people to be aware of protocols against infection, how do we rationalize our management, and I'm glad that we have an ID department that is in the process of coming. Our summer internship programs have been a success. We are starting one next week, Ignite for the children, and we've had people come from different parts of the nearby area to come and learn about healthcare. The Kerala Cancer Initiative was a huge success, and we should do more. So also the telehealth initiative and the telemedicine that we have. Now going on to what are we headed? What is the widening vision? What are we looking at? And this is why I said these are just ideas that we have, but I'm sure many of you will have much bigger, better ideas, and I hope you'll share it with us. Please feel free to write to me anytime so that we can include that. But we'll have some retreats as well so that we can talk about this. You know, one of the reasons that I speak with confidence is because I made a lot of mistakes while I was director of CMC. I went to nearly every pediatrician in CMC and spoke to them about the need for specialization, how medicine has grown because of specialization. And in India, you cannot but specialize. You can go to UK and remain as a family physician. You can remain as a general surgeon. But in India, if you want to progress, you have to specialize. This I tried to tell my pediatrics colleagues. They said, no, we all want to be together. That was 20 years ago. Fortunately, things didn't go bad. They now got a 250 crore donation from sick kids in Canada, saying, please set up a state-of-the-art pediatrics center, institute, with specialization. And the money has come, and therefore they are going to start an institute with all the specialties in pediatrics transplants. But then there have been some exciting things as well. We realized that a lot of patients were going to Madras, to Chennai, because we didn't have the facilities. So it is easy to build a hospital within the hospital. We call it the A block. And that brings in 100 crores every year for CMC. AB will probably correct me and say, no, it's 110 crores. But it's something that has been an undiluted success. We brought all our labs together in one building, which is called the Asha building. That worked. These two things I didn't have to ask anyone's permission for. I went ahead and did it, though I got a lot of flack for it. And then I told you the chip story, how I learned from my mistakes, but today it's a great success. But my biggest, what looked like a failure at that time, was the new campus. I had 39 meetings trying to explain to people the need, because we were 2,000 OPD at that time. Today we are 12,000 OPD. Foreseeing that, I said we need a new hospital because already we were full. A lot of people said, you're destroying the institution. We love to be together. So 39 meetings, every meeting I could see that I was losing more and more people. So towards the end of my tenure, though I started with 95% people on my side, I dropped to 70% people. Why? Because they said, no, this is a stupid idea. And then my successor decided to shelve the project. Though we bought that 100 acres of land, though we got the architects, planned the whole thing, and handed it over to my successor, he didn't believe in it, he shelved it. So the person after that had to come and revive the whole thing 16 years later. So I must again be grateful to Mr. Ebenezer Sundarraj, who as General Superintendent actually, along with Sunil Chandy, built the hospital. So shall we give him a big hand? So from something like this, we now have this, which is in a 100-acre campus, going to be 2,500 beds, totally 2,000, now 1,500 beds have opened. And EB told me yesterday that just from this campus alone, the day he came, that was day before yesterday, CMC had earned 3.9 crores a day, 4 crores a day. Why? Because all the specialties have moved, all the needy patients have moved there, no crowding, it looks like an airport, it looks really well done. And people were worried about, we had taken 800 crores as a loan. And every day he's getting us, just from this building alone, 4 crores. The treasurer tells me that within a few months, the whole thing will be paid off. So if we have the vision, if we are caught in a mission working together, a new paradigm is easy in the healing ministry. And this is the excitement that I have, because there is a great opportunity opening out for us. So I want all of you to read some books, because healthcare is a science and an art. So you need to know the art, you need to love the art of caring, but you should also know the science. Without that, we will be arguing endlessly and we won't know what to do. So read Good to Great by Jim Collins, and a book which he wrote much earlier, How Do You Build to Last? There's a beautiful book that has recently come out by John Maxwell called Leadership. And I was shocked when I read it, that it is exactly what we do. About leadership, about inclusiveness, about oneness, about working together. And Hank McKinnell, the chairman of Pfizer, wrote a book called A Call to Action. And Simon Sinek, I know many of you are reading. This book is a big hit, Start with the Why. But also, Bryant Myers writes a lovely book called Walking with the Poor. So what is the idea of believers? And those of you who must have been going to sleep, next few minutes you must listen to me, because there are some terminologies which are very important for you to learn, which you must introduce into your department. So what is the idea of believers? Jim Collins writes saying that good is the enemy of great. Okay, today we are good. And so we think that we are the best. We are not. After COVID, thanks to all the fantastic work you all did, we have this huge influx of patients. But that doesn't mean we are still the best. So if you want to become the best, what does that mean? A lot of people keep asking me. So good to great, if you want to get there, there is something called the inflection point. Some of you have read the tipping point. This is something like that. Something happens here which, with all the dreams and the plans and all that, you are good, not great. And this is now, Jim Collins' book is based on large series of studies that they've done with a large number of institutions. Those who are ordinary, those who are good, those who are great. And then telling us what is the way forward. So there is an inflection point which will then lead us to greatness. And what is greatness? How do you define great? And I think this is very important. In our context, great should be that this should be the hospital where you will take your father or mother, your brother or sister or your child, if one of them has an illness. You will not go to Vellore. You will not seek the AIM or anywhere else. This will be the place which to you is the best. That is great. Similarly, this should be the medical college where you'll send your child, because your child will then get the best education. That should be the way in which we approach greatness. So, if you look at yourselves, you will find that many of you are in one of these levels of leadership. There are 5 levels of leadership. You can be very capable, but on your own. You can be contributing a lot, and you'll see yourselves in these classes. You may be a good manager. Recently, I told one of our top managers, I said, you're very good with processes, but your relationships will have to improve. So you might be a very competent manager, but then you have to get to level 4 where you're an effective leader. But it's level 5 that combines all this, and you become a top person. Then comes this question of first who, and this is where I need all your help. If you are a family, which we are, you will look for people who will be part of us, wouldn't you? You want people of like-mindedness, people who you feel can do better and better. Get them into your group. Get the ones you don't want out of the bus. So it's a first who. Look for the people whom you want to be part of your team. Look for people whom you will invite here. There are people who are very money-minded. That won't be part of our team. There'll be people who are not very keen on contributing to society. They cannot be part of our team. There may be people who do not believe that you need to be the best. As long as you make your little money in your private practice, those people will not be part of our team. But those who see, understand our vision should be invited to be part of this. And that is why Jim Collins talks about the hedgehog concept, where there are these 3 wheels where, are you very passionate about what you're doing? Do you want to be the best in what you do? And in order to do that, what is the engine? What is your economic engine? Put it all together. And this is your flywheel, okay, which I'm going to talk about. So what is this? What is the flywheel effect? And you will understand that the 2-3 hours I spend every day on the WhatsApp is not because I enjoy being on the WhatsApp. It's to try and get this flywheel moving. Because in the hedgehog concept, you want people who are passionate, you want people who want to be the best, who want to contribute, and so you take steps forward, becoming consistent with what you're doing. You try to do the same thing again and again, and there is an accumulation of visible effects. So 2 o'clock in the morning, I call Dr. Thomas Angelo, because there is this child with a finger hanging like this. I wasn't sure whether I should call him. I called him, he said, "I'm there, sir," immediately. Within a few minutes, he was there in the ER. All other institutions in the country would have said, wait till 9 o'clock in the morning. Thomas came and repaired that. By 6 o'clock in the morning, that boy had a hand. You still have that child with you, Thomas? These are amazing stories which I know will not happen anywhere else. So, like this, I want to present to you all the beautiful things that are happening so that there are visible results. And then what happens? People line up, energized by these exciting things that are happening. And then the flywheel builds momentum. So how does a flywheel move? You slowly start cranking it. And then at one point, the inflection point or the tipping point, it starts moving. After that, everything we do will be wonderful. So you have disciplined people with disciplined thought, disciplined action. There is a total build-up and a breakthrough. And then everything we do after that will be fantastic. That has to happen. So it should not be that every new person who comes to you, you have to take them through an induction program. You do. But they pick it up along the way. They see a sense, a culture, and a quality all around. Because in our kind of mission, in business, money is both an input and an output. In our kind of organizations, money is only an input. All the other beautiful things that happen are the output. So, how do you get to greatness? You deliver performance every time, all the time. Every stroke patient that comes, Anil will be making sure with his team that they get the best possible in the country. And you make an impact. And with each success, you add value. Think of your children. Each time they come with 100 out of 100, you get excited. And then it becomes a habit. I had a colleague who did extremely well in everything. I asked him, how did you do so well? He said, my problem was each time I went home, my grandparents, all of them are academicians. I'd get 99.5. They'll never congratulate me. See, what happened to the other half a mark? So I'm not saying that we should do that, but there is a culture wanting to do. And ours is not an executive power-based style. It is an inclusive partnership approach. And this system that we have introduced is a soft, inclusive, all of you are part of this consensus building. We need to be decisive and on time every time. Remember this statement. Leadership is not the name as the exercise of power. True leadership is when people follow, when they have the freedom not to. So when your teammates stay with you, though they know that they can go for better money, then you have achieved and you are a great leader. This is a story of someone called Roger Briggs who started a counterculture. I have also realized that if you want to succeed, you need a person who's very good and you need a movement. Roger Briggs started a movement in an organization with the first Who principle. She was just a teacher in a school. No power, but she had influence. And it went viral all over America. Or Wendy Kopp, who got teachers from all over the country to come and teach for America. 500 recent graduates came together to be part of this. So therefore, in order for us to succeed, we need a desperate longing for a meaning in our lives, a purity of mission, and a power to ignite passion and commitment. Or this one, turning the flywheel, power of the flywheel, breeding support and commitment, greater success, more support and commitment, and all of us welcome people who want to be winners. And where this is how we started as a small motley group once upon a time, 9 years ago. And today we can dream, and I am happy to let you know that the sanction for the new building has come after much struggle for the new specialty block. We've got permission to build now. We're just looking for the money so that we can start. And the hope is to start both that as well as the tall tower building, which will probably change the face of Kuttapura once that building also comes. So we have been given permission by the church to rename ourselves or rechristen ourselves as the Believers Academy of Medical Sciences. Sorry, I think something is wrong here. So I'll just read it out to you. So we'll become a JCI accredited Believers Hospital, a NAC accredited medical college, the best nursing college in the country. We'll start a nurse practitioners program, a Believers Institute of Allied Health, College of Pharmacy, postgraduate programs, PhD programs, the Believers Institute of Research, Advanced ICMR, DST, DBT Research Center, Center for Transitional Research, International Center for Clinical Trials, artificial intelligence in healthcare, big data mining, and we want to become the Believers Healing Village. We have enough medicities around, but we will become a village which will provide healing to people, and we'll be the numero uno in healthcare. We will be the best medical college hospital. We will be the best healthcare ecosystem in the country, and a hub and spoke model to help smaller hospitals. We will have a very good physiotherapy, occupational therapy, and a CDC. We will have very good pain and palliative care department, and maybe even a hospice and a de-addiction center. And I want to end by these words by our president, Dr. Abdul Kalam, who one day walking in the garden wrote this poem. I climbed and climbed, where is the peak, my Lord? I plowed and plowed, where is the knowledge treasure, my Lord? I sailed and sailed, where is the island of peace, my Lord Almighty? Bless me, bless my nation with the vision, sweat, which will result in happiness. He talks about a vision, and he talks about hard work, which will result in a joy, not only for us, but for the whole country. I pray that this will be our future over the next 8 years. Thank you very much for your patient listening.
Next time for questions. Thank you very much, Dr. George Chandy, our guide and mentor for that look into the future, and that invitation for all of us to be part of it. Thank you. Wish you all a good day.
Things. You listen to the news, you hear stories. There's so many bad that's remained to where we are today. And I will. I love you, Lord, for your mercy never fails me. In all my days, I've been held in your hands. From the moment that I wake up until I lay my head, oh, I will sing of the goodness of God.